We're going to listen to this guy talk about biochemistry. Isn't that a thrill? Okay, well, I'll try to make it fun, because actually, it is fun. Yay, it's fun, because you know what? The stuff that I'm going to be talking about this morning, it's happening inside of you right now. Doesn't that give you a little thrill? I can feel it. Are you feeling it? Yeah, so we're going to talk about physiology, inflammation, etc. And we're going to talk about different ways to deal with illness besides what we've been taught in medicine. Now, this is not alternative medicine. This is complementary medicine. This is integrative medicine, and that's a really important point. I prescribe plenty of pharmaceuticals. I'll admit it, right? But I try to use lower doses, and I always try to use things that will help mitigate potential side effects. That's what this is about, functional medicine. It's not about an alternative to the mainstream, and I want to make that point really clear. Those are my disclosures. So this whole node on the matrix is the defense and repair node. We could call it the immune node, but really what is the immune system mostly doing? It's defending and repairing. And when something goes wrong with either one of those response patterns, you get into trouble. So that's what we're going to focus on. And I always like to start with this quote by the famous philosopher, physician, Moses Maimonides. Teach thy tongue to say, I do not know. Teach thy tongue to say, I do not know, and thou shalt progress. Once you think you understand what's going on, you're screwed. You are screwed. Because every day, we're coming up with new discoveries about how the immune system works, what's going on a molecular level, what a disease, thing that we call a disease, what is that really all about? Right? So if we get stuck on treating inflammatory illness with a COX inhibitor, and we think that's the end of the story, then we're going to miss the boat. And so the whole point of this lecture is to really expand your horizons, is to open your mind in terms of what actually is going on in the body when you see this inflammatory response. So a couple of key concepts here. Inflammation is a normal response pattern. It's normal physiology. It's simply the body attempting to defend itself against foreign invasions and then repair itself after any injury from that foreign invasion or from some kind of damage. It's normal, so we don't want to shut it off. We may want to tone it down, we may want to dampen it, but we always want to be asking the question, what is the immune system doing? Why is it responding this way? Instead of, oh, that's bad, turn it off. You've got rheumatoid arthritis, that's bad, turn it off. What's the body responding to? Why is it trying to do that? So inflammation is normal. Number two, there are molecular triggers that set the inflammatory process in motion. And these fall into some major categories: trauma, microbial exposure, toxins, or certain foods. And as I'll show you later, every one of these presents with a pattern of some kind of molecular structure. So inflammation is triggered by a molecular pattern. And if you can understand that, then it really takes you a long way towards getting the big picture of how you deal with inflammatory illness. Number three, why do people get chronic inflammation? Either because they continue to be exposed to the trigger, like gluten. You heard about yesterday, like gluten is an inflammatory trigger for most people, and for some people, it's a highly inflammatory trigger. So if they continue to be exposed to that inflammatory trigger, they end up with chronic inflammation, flattening of the villi, joint inflammation, skin rashes, brain lesions, etc., because there's ongoing exposure to the trigger. Either that or the immune system doesn't turn itself off properly. Counter-regulation. Every time inflammation is turned on in the body, it's automatically turned off. right? There's very highly controlled mechanisms that do that. And if something is wrong with that system so it doesn't turn off, then the trigger can set things into motion that cascade and can last for months, years, or a lifetime. Almost any chronic disease that you can name is linked to chronic or excessive inflammation. And we'll talk about that in some detail. Pharmacology works way downstream, almost without exception. Pharmacology looks at a particular mediator, like inflammatory eicosanoids, and says, let's turn off the enzyme, the COX enzyme, that makes that inflammatory eicosanoid. Or let's turn off the LOX enzyme that makes that inflammatory leukotriene. Or let's use a biologic to block TNF-alpha. That's way downstream. And that's fine if a person's got a lot of TNF-alpha in their system and that's creating a huge amount of inflammation. Using a biologic may be the best thing you can do to stop the immediate symptoms, but it's not a good long-term solution. It's not a complete solution. It's a start. So I see pharmacology as the starting point, not the end point. That's one way to think about it. Whereas functional medicine is going way upstream and saying, what are the conditions that created this scenario? Right? Was it the person's diet? Was it the work environment that they're in? They exposed to toxins? Are they engaged in repetitive motion, which causes a tendinitis? You know, so many different ways that could occur. Well, we want to go upstream, and we want to look at those conditions and say, how did this happen to begin with? Because once we've identified the conditions that allow this to come about, then we can remove the trigger. And that may seem kind of obvious, but I can guarantee you there are many rheumatologists that would never think, here's a person with joint disease, perhaps they should try something simple like a gluten-free diet. It's a really profound thing that's very evidence-based, and yet in mainstream, for some reason, that's not thought of. That's somehow soft science, nutrition. It's soft science, but it's got plenty of evidence behind it. So we look for the triggers, we remove the triggers, and we modulate the mediators. We use things like omega-3 fatty acids to actually change the kind of inflammatory mediators that are being made in the body. We're going to talk about all this stuff in great detail. So the word inflammation comes from inflammare, to set on fire. And this is one of the earliest described phenomena in medicine. In fact, there is writings going back to the ancient Egyptian times on an Egyptian papyrus. I think it's called the Ebers Papyrus, that describes this inflammatory phenomenon. The way we talk about it in the West was based on the description from Cornelius Celsus, who wrote this around 30 to 40 AD, and that's the tumor, rubor, calor, and dolor model. Swelling, redness, heat, and pain. And then later, Galen added loss of function, functio laesae. So you see on the left, the heat, the guy with the red face next to him, the swelling belly, the pain, and the loss of function. So this is the classic description of inflammation, one of the oldest medical phenomena described in the medical literature, going back thousands of years. So ancient physicians knew that there was some kind of pattern at work here. And it was a repeated pattern. It would happen in a very predictable way in response to exposure to certain triggers. So here it is at work. This is a person that's had a wound that's been sutured up. And you see the swelling and the redness. It would be warm to touch. It might be a little bit painful. What's the number one question you need to ask yourself when you see this? The question is this an appropriate level of inflammation, or is the wound infected? In other words, let me frame it in a different way. Is this going the right direction? So when you see it, you go, yeah, that's inflamed. If you, to the trained eye, I suppose to an untrained eye, they would look at that and go, oh, that looks horrible. It's all red and crusty and there, you know, there's damage to the tissue. So an untrained eye would say that looks bad. Right? To the trained eye, they would say that's a great result. Great wound healing. Okay? But then you're always asking the question, what is the trend? What's the trend? What direction is this going? Is this looking bad? You know, is it starting to get purulent? Are you getting excessive drainage? In other words, is there something I need to do different other than standard wound care? And that same idea can be applied to any inflammatory process. You ask the question, what is the trend? You've got a person with rheumatoid arthritis, they've got red swollen joints, and you introduce an intervention, you put them on a gluten-free diet. Well, maybe their joints don't get better overnight. But after a month or so, you ask the question, what's the overall trend? Are you starting to get better, or are you getting worse? So we're interested in trends here. This came out of the notion of chaos theory, right? What does chaos theory say? It says it's all about what's the trend, what's the weather pattern like, what's the trend of that hurricane, where's it going to go? We want to be able to predict that. Very, very important. So in order to go upstream, we need to know something about triggers. And I will submit to you that every trigger that's been described for the immune system is molecular. So if you think about those basic categories that I talked about earlier, there's trauma. And what happens with trauma? With trauma, you split tissues apart. Now you've got fragments of DNA and mitochondria and other intracellular proteins that are in the circulation. Well, there are receptors for those mitochondrial fragments on immune cells. The immune cell sees the mitochondrial fragment, says, that's not supposed to be in the bloodstream. That's a mitochondria. Well, it may not say that. I mean, actually say mitochondria. But it says, that's foreign. It thinks, okay, that's anthropomorphic. It's a smell. It smells it. Can you buy that? So it smells the smell of mitochondria. You smell mitochondria? I smell mitochondria. Now, I'll tell you something. The very interesting study that came out last year, it turns out when people are under stress, they release mitochondrial fragments into their bloodstream through mechanisms unknown. But mitochondrial fragments go way up. So they took a group of people and they accused them of doing something that they hadn't done. Of course, those people freaked out, their cortisol went up, etc., but they measured mitochondrial fragments in their bloodstream, they went way up. So that's a connection between stress and inflammation. So nucleic acids, mitochondria, pathogenic microbes, sticky buns, advanced glycation end products. Sticky buns, right? Those look just like pathogenic bacteria or yeast. We've got receptors for sticky buns. Long before they ever made sticky buns, God said, I will therefore make, on the 9th day of creation, I will make receptors for sticky buns, advanced glycation end products. Toxins, how do they create a molecular pattern? Well, toxins often create oxidative stress. So when you create free radicals, that damages tissue. The immune system says damaged tissue responds to damaged tissue. Or a toxin like PCBs can bind to albumin in the bloodstream and create what's called a neoantigen. And that neoantigen is now a foreign molecule that our immune system will recognize. So again, this is a process with a purpose. And the purpose is to defend against invaders. And there's several different mechanisms involved in doing that. Pouring bleach or other toxic chemicals on them or eating them. That's a great solution, isn't it? The bad guys are here. Let's eat them. Let's eat them. And I'll show you some X-rated pictures of that. Then there's a repair of any damaged tissue that happens after the invasion. And part of that repair involves sequestering the area, shutting it off, and activating the healing response with fibroblasts. So some of you might have heard about this newly discovered organism called Candida albicans. Apparently, it's quite toxic. And you get it if you eat a lot of sugar. It grows on your mucosal membranes all over the body. And this is a cell called a macrophage. And the macrophage is eating it. Oh, yeast overgrowth. Eat it. Eat it. Just like, you got a dog. Anybody got a dog? That's what they do. Right? What is that stuff? I don't know. Let's try eating it. That's what macrophages do. What is that? I don't know. It's foreign. Let's eat it. But how does the macrophage know to eat it? It knows because there's molecular patterns on the surface of the yeast. Zymosan, among others. So there's these molecular patterns, and the macrophage has a receptor on there. Just like it has a receptor for sticky buns, it's got a receptor for yeast. That macrophage is normally quiescent. It's dormant, it's sleeping, and then it bumps into that Candida albicans, and suddenly it wakes up and becomes an ogre. Urgh. I'm having you for lunch, dude. So important concept about the immune system. It is normally dormant. These cells are floating around in the bloodstream, taking a nap. And when they come in contact with these molecular signals, they get activated, they get stimulated through a multi-step process. And when they get stimulated, they get to the nearest edge of a blood vessel and they start rolling along, a process called adhesion. And then they begin to migrate towards the site of the injury, and then they get fully activated. They start making little darts called cytokines. In addition, they send out signals to the surrounding blood vessels that say, hey, it's time to vasoconstrict, and it's time to get more coagulant. So you want to shut off the blood supply. That makes sense, right? Here's the site of the injury. Let's shut things off. Now, the way I think about these signals, have you ever gone on a picnic and you checked everything out, you sat down at the table, not a bug to be seen. Not a bug to be seen. You open your chicken, or if you're vegetarian, you open your tempeh, and all of a sudden there's wasps everywhere. How did they know? It's because the chemical signals that get released from the chicken or the tempeh get into the air, and the wasp can smell those a mile away. So they home in. The same thing happens when there's a tissue injury. Tissue injury sends out signals. Signals get into the bloodstream. Those signals then activate the immune cells, and then they migrate. They get activated, and then they start making poison darts, etc. Part of the poison darts are free radicals generated by two major enzymes, NADPH oxidase that makes superoxide, and myeloperoxidase that makes bleach, hypochlorous acid. Now, one way you can tell if the immune cells or endothelial cells in the body are being activated by these kind of chemicals is myeloperoxidase levels will go up. And myeloperoxidase, MPO, is actually a marker as a risk factor for cardiovascular disease. So that's immediately a way that you can take some of this information home. And I measure MPO in my patients all of the time. Very useful marker for risk. We also make these little darts called cytokines and chemokines, and then the liver makes proteins like C-reactive protein that have a wide variety of roles in basically shutting down the process involved in the invasion. So we have the injury activates the white cells. They wake up. Polly Matzinger, the famous immunologist, she says our immune cells are sleeping. They're sleeping. They're sleeping, and then all of a sudden they smell the chicken. They smell the chicken, and they wake up, and they go, oh boy, lunchtime. Something for me to do. So when they get activated, they release all these free radicals, right? And they also release something we'll talk about in more detail, leukotrienes and prostaglandins, and then that activates more neutrophils and sets this feed-forward cycle into motion. Now, if you think about it, what are the implications of this? If an inflammatory trigger sets off release of free radicals, that's going to damage tissue, right? What happens if you've got a chronic infection in your gut? That's going to damage tissue. What if you have dysbiosis, which is not really an infection, but an overgrowth of unhealthy bacteria? That's going to damage tissue. So maybe we've got a protection against that. It's called antioxidants. Antioxidants. We make our natural antioxidants like glutathione, but you can also take antioxidants, vitamin A, E, C, zinc, selenium, glutathione, N-acetylcysteine, plants like curcumin, blueberries, all of those things. And what they do is they actually help mitigate the collateral damage that you get from chronic infection and chronic inflammation. Are you with me on that? So I just took a kind of leap out of basic physiology and I extrapolated and I said, well, wait a minute. No, if we go upstream and we say, what's happening here? What's the process? What can we do about that? We can do some really basic things. So this process with a purpose, if the trigger is in the lungs, it can make mucus. If it's in the nose, it can make mucus. If the trigger is a pollen and somebody's allergic, then the smooth muscle can contract and they can wheeze. If you put your hand near a noxious stimulus, a needle or a flame, then you feel pain and you pull back, right? But the same thing is going on when a person gets an infection and they produce cytokines that create a psychoneuroendocrine reflex, right? So it's the same thing. The body is pulling back. You have an infection and your brain goes, ow, I don't like that. So we're going to talk about that concept, which is called cytokine sickness, in some detail. When these white cells get activated, they start releasing all kinds of chemicals. Locally acting chemicals called autocoids. We'll talk about those. Activation of complement. So complement are all these proteins that are floating around in the bloodstream in a big inert state. And when they come in contact with a fragment of something like mitochondria or a bacteria, the complement splits apart. And when it splits apart, it becomes a highly inflammatory trigger. We also activate cell adhesion molecules that make the white blood cells roll along the surface of the blood vessel. And we make antimicrobial peptides. Yeah, we make our own antibiotics. So this is the schema that shows what I'm talking about, that summarizes it. You see on the right, tissue damage. And I heard that I actually have a laser pointer that I can use, which is awesome. So tissue damage, there's bacteria on the surface of the skin from the skin microbiome. Those bacteria then get into the bloodstream. They activate the macrophage. It wakes up. So the macrophage wakes up, makes inflammatory cytokines, interleukin 1, interleukin 6, TNF-alpha. It makes prostaglandins and leukotrienes. Those are the signals that tell the wasp over here in the bloodstream, come hither. Come hither. There's a picnic going on. At the same time, that tissue damage activates complement. Complement splits, forms C3A and C5A, the complement split products. Those bind to the surface of mast cells. Mast cells release histamine. And also, that is a signal that's telling the bugs, come on over. There's a party. This is going on in our immune system, in our body all the time, whether you have a disease or not.